present a review of legal considerations when responding to this solicitation, a brief overview of the Mass Technology Collaborative and MIHI, the Mass eHealth Institute, followed by a more detailed overview of the eHealth Equality Incentive Program, or eQIP. We will then review the individual components and requirements of the solicitation, including eligibility criteria, milestones, timelines, and application process. Note that some of the solicitation components have been edited for brevity in this webinar. Please refer to the entire solicitation for precise requirements. My name is Judith Iwanski. I'm the manager of MIHI's eHealth Equality Program. Also with me today are Ross Venables, Mass Tech Grants and Contract Administrator, and Olivia Joplin, eHealth Programs Coordinator for MIHI. We expect that there will be time at the end to answer questions that were submitted during the presentation. Additional questions may also be submitted in writing to proposals@masstech.org. The slides and audio from this presentation and all Q&As will be posted on the MIHI website. Okay. This will be a brief discussion of legal consideration when responding to the solicitation. Ross?
Thank you, Judy. If we could just, hello everybody. This solicitation has been posted to the MIHI and Mass Tech websites, also to ComBuy's, the Commonwealth's procurement portal. To the extent that anything stated or presented in this webinar is consistent with the RFP document, the solicitation, the written document shall govern. Mass Tech reserves all rights to amend, modify, or otherwise clarify the solicitation and any written answers to questions presented. Please check frequently with the MIHI, Mass Tech, and/or the ComBuy's websites for any addenda or modifications. It's the respondent's responsibility to be aware of any changes to the RFP. Please review the solicitation carefully. Non-responsive applications will be rejected.
Thank you, Ross. I'm not going to spend a lot of time on the Mass Tech overview. Please refer to our website for additional information. In brief, the Mass Technology Collaborative is a public economic development agency established pursuant to Mass General Laws, Chapter 40J. It is an independent authority of the Commonwealth of Massachusetts. The Massachusetts eHealth Institute, or MIHI, is a non-divisible component of Mass Tech and functions as one of its business divisions. Other divisions under the Mass Tech umbrella are the Innovation Institute and the Massachusetts Broadband Institute. MIHI is dedicated to the advancement of healthcare through the use of technology. It is the designated state agency for coordinating healthcare innovation, technology, and competitiveness, accelerating the adoption of health information technologies, for promoting eHealth IT to improve the safety, quality, and efficiency of healthcare in Massachusetts, and to advance the dissemination of interoperable electronic health record systems in all healthcare provider settings that are networked through a statewide health information exchange, the Mass Highway. This slide shows the high-level vision, mission, and goals of MIHI, including supporting the triple aim of health reform: better population health, improved patient care, and lower cost of health care. MIHI's focus is to drive the adoption of health IT among all healthcare providers in Massachusetts in order to positively impact healthcare and achieve the triple aim. MIHI provides eHealth assistance through programs, services, collaboration, education, and funding. At a high level, MIHI currently has 4 major initiatives: the eHealth Equality Program, the Connected Communities Program, eHealth Services and Support, and the eHealth cluster development. This eQIP solicitation is administered as a part of the eHealth Equality Program. The objective of the eHealth Equality Program, or eQIP, is to promote effective use of interoperable EHRs by eligible behavioral health provider organizations in an effort to improve the quality and efficiency of healthcare in the Commonwealth while containing costs. Note that for this incentive program, it's for eligible organizations, not eligible providers, as under meaningful use. eQIP payments will be made to the organizational applicants. As noted previously, one of MIHI's goals is to advance dissemination of EHRs in all healthcare provider settings and facilitate their secure networking through the Massachusetts Highway. Current data, including a recent MIHI provider survey, has shown that many independent behavioral health organizations, those unaffiliated with large providers or healthcare systems, are lagging behind other healthcare sectors in the adoption of EHRs. Chapter 224 of the Acts of 2012, the second major piece of health reform legislation passed in Massachusetts, directed MIHI to prioritize assistance to organizations that are generally not eligible for Medicare and Medicaid EHR incentive programs and that lack access to other resources to implement EHRs. The legislation specifically referenced mental health facilities and community-based behavioral health, substance abuse disorder, and mental health care providers. For the purpose of this solicitation, behavioral health services are defined as direct patient care services by behavioral health providers used to evaluate and treat people with mental health and or substance abuse disorders, and substance abuse treatment services that are provided through programs that are licensed and approved by the Massachusetts Department of Public Health. Behavioral health providers must provide direct patient care and either be licensed clinicians or clinical staff authorized to provide direct patient care under the supervision of a licensed behavioral health professional. For the purposes of this solicitation, entities are deemed affiliated if their financial statements are part of the same consolidated financial statements. One controls the other, directly or indirectly, or they are under common control. Definition of total organizational revenue is the aggregate amount of revenue from all sources of income, both within Massachusetts and out of state, for all facilities and operations within the same corporate structure of the applicant entity. Patient service revenue, as used in the eligibility criteria, is the total of net patient service revenue from third-party payers, that's gross PSR less any contractual adjustments, plus any payments under a state or local contract to provide behavioral health services to public payer clients. MIHI reserves the right to further define the terms that are used in this solicitation. As I said, this is MIHI's second eQIP solicitation for behavioral health organizations. The major change from round 1 to round 2 is that round 2 is open to both not-for-profit and for-profit organizations. Also, the minimum threshold for participation in this solicitation has been lowered from $1 million to $500,000 or $500,000 annual total organizational revenue. In addition, we've addressed some feedback we received in the earlier round by making some program modifications. These are applicable to both round 1 grantees and new grantees under this solicitation. First, the program duration. The end date was changed from December 31st, 2016 to June 30th, 2017. This gives an additional 6 months for grantees to meet program milestones. We have moved the EHR installation and achievement of MRAM Stage 3 from Milestone 1 to Milestone 2. Grantees will now receive Milestone 1 payment upon submission of a MIHI-approved transformation plan and highway use case. CERT is required only for subsequent stages. 3, payments have been adjusted to pay 25% of the total payment for each milestone. Formerly, we were going to pay 15% for Milestone 1. Now we're giving a larger amount up front. And finally, Milestone 4, the highway milestone, we will also accept transacting on another HIE to meet this milestone, so long as that HIE is connected to the Mass Highway. Any organization receiving a grant under the incentive program is required to do the following. First, they have to use certified EHR technology, or CERT, to meet the functions specified in each milestone. While CERT does not guarantee interoperability, it does help to ensure that the EHR will provide standard-based functionality and support interoperability. MIHI uses the ONC's Chapel website to verify CERT status. If a vendor's product does not appear with a certification number on the Chapel list, it is not ONC certified for purposes of this program. MIHI is open to requests for exemptions from certification in very limited instances when no viable certified product exists for a particular function. MIHI is aware of recent ONC changes and is now considering how best to incorporate these changes into the grant while still maintaining the goal of interoperability. Next, grantees must submit a questionnaire to the Healthcare Information and Management Systems Society, or HIMSS, Analytics Ambulatory EMR Adopted Model, that's AMRAM, to determine their EHR adoption baseline. They must develop an approved transformation plan and use case. They must commit to achieving all 4 eQIP milestones, and they must submit a midterm and final reports and attend a grantee in-person event once annually. To be eligible for participation in the incentive program, organizations must meet all of the program's eligibility criteria. In the next few slides, we will review the details of each of the 6 eligibility criteria. We will also review the documentation required to substantiate that an organization meets each of the criteria. First, an organization must provide direct patient behavioral health clinical care services in Massachusetts. For examples of non-clinical services are those services that enable individuals to access health care, case management, referrals, translation, transportation, health literacy, outreach. To substantiate this eligibility requirement, organizations must submit documentation indicating that it received patient service revenue for behavioral health clinical services in any 1 month. See attachment A1A. Second, an organization must hold a currently valid license to provide behavioral health clinical care programs and services in Massachusetts. If the organization is not required to be licensed, its clinical providers must have valid professional licenses required to provide behavioral health programs and services in Massachusetts. A copy of the current licenses must be submitted with the application. Upon request, an organization must submit lists of providers licensed to provide behavioral health clinical services in Massachusetts, including name, license type, and expiration date. The third eligibility criteria, organizations must provide primarily behavioral health services in Massachusetts. That is, more than 50% of annual total organizational revenue, that's revenue from within or outside of Mass, must be patient service revenue from the provision of behavioral health clinical services in the Commonwealth. Documentation indicating that the percent for the most recent state fiscal year is required, and these revenue figures must be documented in the chart in attachment A1B. Importantly, the figures must be accompanied by appropriate audited supporting documentation. This could be a Uniform Financial Statements and Independent Auditor's Report, or UFR. Fourth, an organization may not be affiliated with a system that includes an acute care hospital. We'll go back to the definition of affiliated in the solicitation, where entities are deemed affiliated if, one, their financial statements are part of the same consolidated financial statement, two, one entity controls the other directly or indirectly, or three, both entities are under common control. This is part of MIHI's charge under Chapter 224 to focus on those organizations that lack access to other resources to implement interoperable EHR systems. Applicants must provide a full and complete corporate organizational chart showing the ownership, governance, and operational structure of the provider organization, and including any parent entities and all affiliates. There are two exceptions to this criteria. First, organizations that are part of such a hospital system are eligible if the annual organizational revenue of the parent organization or system is less than $25 million. We have received quite a few questions around this criterion. So to clarify, we are posting an amendment to the solicitation to clarify the second exemption. An organization that is part of a system may meet this criterion if the system holds a minority ownership interest in the organization, the system does not exercise governance or management control, and the organization's financial statements are not consolidated with those of the system. If the organization has a relationship with an acute care hospital or system with an acute care hospital, it must provide a copy of the relevant agreements between the organization and the hospital system or component thereof. Note that any confidential provisions in such agreements should be redacted prior to submission. In lieu of submitting the entire agreement or agreements, the organization may extract and submit the portions of such agreements that describe the management relationship between the entities and the nature of the ownership interest in the organization. It is incumbent on the applicant to disclose the relationship and explain why it does not meet the definition of affiliate. The fifth eligibility criteria is that the organization must serve a large proportion of public payer clients. That is, greater than 50% of the PSR from Massachusetts facilities is from public payer. Chapter 224 requires an emphasis on organizations that serve a high proportion of public payer clients. The intent is to support those behavioral health provider organizations that provide healthcare services to some of the Commonwealth's most vulnerable individuals who receive multiple and costly services across the care continuum. It is particularly important that these organizations are capable of electronic communications with other healthcare providers that may be treating those individuals. To substantiate this requirement, the organization must submit documentation indicating the source and amount for all behavioral health patient service revenue from Massachusetts, that's private payer, Medicaid, Medicare, etc., for the most recent state fiscal year, and showing that 50% is from public payer. These revenue figures must be documented in the chart in attachment A1B, and the calculations must be accompanied by an audited supporting documentation, such as the Uniform Financial Statements and Independent Auditor's Report, or UFR. The final eligibility criteria is that the organization may not be an eligible hospital or have eligible providers, as those terms are defined by the federal Medicare and Medicaid EHR incentive programs. One exception, an organization with some eligible providers may be eligible if less than 30% of the organization's clinical care providers are eligible professionals and the organization is either not affiliated, is not affiliated, and that annual total organizational revenue of its parent or parent organization or system is less than $25 million. Substantiation requires a statement documenting that the organization is not an eligible hospital under the HITECH Act and that its providers are not EPs under the definition of the Act, or verification that less than 30% of the organization's clinical care providers are EPs and the organization is not affiliated or the annual revenue is less than $25 million. I'm going to let Olivia take the next round.
MIHI will consider other factors in reviewing applications, including how the organization intends to use health IT in light of Massachusetts healthcare policy objectives. MIHI may contract with those applicants that meet the eligibility criteria, clearly describe approach feasibility, organizational ability and capacity, and anticipated impact, and lastly, sufficiently demonstrate organizational need and commitment to implementing an interoperable EHR and transacting on the Mass Highway. We will review these other factors later in the presentation. In addition, MIHI is collaborating with EOHHS to provide optional additional funding to eQIP grantees to maximize EHR interoperability capabilities. The State Innovation Model, known as SIM, Mass Highway Grant is a companion grant to eQIP. It is additional funding to optimize grantee highway use cases and maximize EHR interoperability to achieve interoperability across the continuum of care. eQIP Milestone 4 requires connection and use of the HIE or Mass Highway to exercise its use case in production with at least one trading partner with which it is not affiliated or joined together contractually or through a shared entity, and development of an approach to operationalizing opt-in patient consent for the Mass Highway. Additional SIM funding will assist grantees to achieve greater volume of transactions on the highway and increasingly sophisticated use of the highway. This companion grant is closely aligned to eQIP, but is a separate funding program and will require a second application through EOHHS. This slide provides an overview of the eQIP milestone requirements. I will go into more detail in the next slides, but in general, the requirements for each milestone are as follows. Milestone 1 requires a transformation plan and development of a highway use case that have been reviewed and approved by MIHI. Milestone 2. This is the first milestone to require an EHR. It requires an achievement of MRAM Stage 3, as well as a description of the organization's certified EHR technology. Milestone 3. This requires the achievement of MRAM Stage 5 and an updated description of the certified EHR technology. Lastly, Milestone 4 is integration of the Mass Highway or an HIE connected to the highway with the EHR. This will require a copy of the HIE Mass Highway Participation Agreement, an attestation from the grantee and the trading partner that production transactions are being sent or received for the use case described in the Highway Use Case Form, which is developed in Milestone 1. And lastly, a description of the organization's approach to operationalize opt-in patient consent for the HIE/Mass Highway. Grantees are paid 25% of the total incentive for each milestone achieved. Milestones 1 through 3 must be met in sequence, but organizations can meet the highway milestone, Milestone 4, at any time after meeting Milestone 1. For eQIP, MIHI has aligned Milestone 2 and Milestone 3 to the HIMSS Ambulatory EMR Adoption Model, known as AMRAM. This EMR adoption evaluation model focuses on key IT systems that need to be implemented for achieving higher levels of access, quality, efficiency, and safety. This chart provides an overview, giving examples of the requirements to meet each stage. The full MRAM model has 7 stages. However, note that eQIP grantees will meet Program Milestone 3 upon reaching AMRAM Stage 5. Grantees will be required to complete a HIMSS online survey within 30 days of contracting with MIHI to achieve an MRAM score. This score will determine an organization's baseline for milestone payment. In addition, grantees will be required to incorporate that score and the gap assessment findings provided by HIMSS into the transformation plan that is required for Milestone 1. These next slides describe the milestones in more detail. Milestone 1 requires the development of a transformation plan approved by MIHI that describes how the organization will prepare and transform its practice to maximize the potential of its investments in health IT in order to achieve identified outcomes. The plan must include, first, anticipated outcomes, including the operational and/or clinical outcomes being targeted and how the grantee will use implemented health IT to better integrate behavioral with physical health care. Second, current state of analysis, the current health IT state of your organization's practice. Third, future state analysis, the desired future health IT state of the organization's practice at the end of the period of performance. 4, gap analysis, the gap that exists between current and future state and how the organization will close that gap. And 5, grant approach, including the approach to meeting each milestone, how the organization will protect its electronic health information, and the timeline of major activities to meet outcome goals and program milestones. In Milestone 1, grantees must also complete the AMRAM survey and complete an approved highway use case development form. Examples of forms are on the MIHI website at mihi.masstech.org. Moving on to Milestone 2. Milestone 2 requires an organization to demonstrate that it meets the criteria for MRAM Stage 3. This includes using electronic messaging, computers have replaced paper charts, and clinical documentation and clinical decision support. Milestone 2 also requires providing a description of CERT, including vendor, product, care setting, and extent of use. Moving on to Milestone 3. Grantees must achieve MRAM Stage 5, which includes personal health records, an online patient portal, computerized patient order entry, or CPOE, use of structured data for accessibility in EMR, and internal and external sharing of data. Grantees must also provide an updated description of their certified EHR technology, including care settings and extent of use. Lastly, Milestone 4, grantees must connect to and use the Mass Highway or an HIE connected to the highway to exercise their use cases in production with at least one trading partner with which it is not affiliated or joined together contractually or through a shared entity. Note that this is a broader standard than affiliated for purposes of eQIP eligibility. For purpose of this grant, webmail is not a sufficient means for transacting via the highway. MIHI's intent is to advance interoperability, thus using an EHR direct connection or a gateway device such as a LAN device is required. Grantees must also provide the organization's approach to operationalize opt-in patient consent requirements for the Mass Highway or HIE connected to the highway. Discussing the transformation plan in more detail, Milestone 1 requires the development of a transformation plan approved by MIHI that describes how the organization will prepare and transform its practice to maximize the potential of its investments in health IT in order to achieve identified outcomes. Grantees must also complete a highway use case development form. This slide reiterates some of the requirements of the transformation plan required for Milestone 1. Once a grantee is accepted, the transformation plan must be submitted within 90 days of execution of a grant agreement between the organization and MIHI. An organization's transformation plan is expected to be very comprehensive, demonstrating a thorough analysis and extensive level of detail. MIHI may request clarifications, modifications, and/or revisions to a transformation plan prior to any approval. This slide illustrates the payment structure. Grantees will receive 25% of the total payment for each milestone. Incentive payments are progressive for reaching advanced health IT integration and will be awarded through the achievement of 4 milestones over approximately a 2-year period. Individual incentive payments are tiered by organizational size and will range between $8,250 and $20,625 per milestone, and they will not exceed a total of $82,500 to any one organization for all 4 milestones. Note that organizations with annual revenue of less than $500,000 are not eligible for this program. I'll hand the webinar back to Judy now.
Thank you, Olivia. We will now present an overview of the eQIP solicitation application process and evaluation criteria. This timeline slide repeats the important dates as related to the solicitation. Electronic applications are due by 3:00 p.m. on Thursday, May 21st, 2015. Hard copies are due the following day. MIHI may add a 3rd webinar if necessary. As Ross said, please check the website for updates to the schedule, solicitation changes, updates to the frequently asked questions, and other relevant information. We anticipate final awards in July of 2015. The next 2 slides outline the RFP application submission process. Please be sure to follow the process exactly as it is laid out in the solicitation. Late applications will not be accepted. MIHI has developed a checklist that is posted on the MIHI website with a list of frequently asked questions that applicants can use as guidance when completing their application packet for submission. We very much encourage prospective applicants to email any questions to us at proposals@masstech.org. Questions and answers will be posted on a frequently updated Q&A section of the eQIP solicitation page on the website. After the filing deadline, MIHI may or may not seek additional information from an applicant prior to making a selection. MIHI will issue a notice of grant award for each application selected for funding that will stipulate the period of performance, the targeted milestones, the terms and conditions of the award, and reporting requirements. A simple Notice of Intent to Submit Application, or NOI, should be submitted. This does not bind a prospective grantee in any way. However, such an NOI is very helpful to MIHI in its review. Although the stated deadline has passed, it would be very useful if prospective applicants still submitted such a notice. As stated in the solicitation, numerous documents must be submitted at the same time as the application. These include a proposal narrative, which has an 8-page limit. We'll show more detail on the next slide about this. Eligibility substantiation forms, that's the organizational behavioral health profile form and a patient service revenue chart with supporting documentation. You'll find these in attachments A1A and A1B. An EHR current product table, if applicable, that's attachment B. The Officer Certification Form, attachment A2. A signed organizational approval letter stating support for the proposed project. An application summary sheet form, attachment D, and an authorized application signature and acceptance form, attachment E. Some of you may have noticed that attachment A1 form is missing in eligibility criteria 5. That is currently being corrected. And also note that the forms in both attachment A1 and A2 will be modified when we post the updated affiliation language. The proposal narrative is a critical part of the application. Each of the items must be addressed. Each section does have a size limit, and the total narrative should not exceed 8 pages. It is especially critical that the abstract capture the significant details of your organization's approach to meeting program objectives. Note that this will be used to orient those reviewers to each applicant's proposal and then will facilitate contract scope writing. The statement of need should describe why the organization needs the funds available through this particular grant program. The project approach should provide a synopsis of the organization's proposed approach to adopt and use health information technology, that currently in use and or that needs to be procured in order to meet each proposed milestone. Applicants must estimate as best they possibly can the total cost of the project and the timeline to reach each milestone. Applicants must complete the EHR current product table, if applicable, including the vendor, product, version, chapel number, status, and extent used. Applicants must disclose their Mass Highway status. If they're currently using the Mass Highway or an HIE connected to the Mass Highway, describe how they're connected, be that land, webmail, EHR Direct, and how they're using it. If they're not currently using the highway or an HIE, describe how they intend to do so. Health systems integration. The applicant shall describe how the organization will support efforts to integrate behavioral health services with other care settings, that is, settings the patient is referred to or from. Examples might include coordinated treatment plans or maintaining continuity of care. In-kind resources. Describe those resources the organization intends to provide to supplement or support these incentive payments and their estimated value. Applicant must designate a project manager for the entire project and describe how senior leadership will oversee the initiative. Value of investment. Applicant must describe how receipt of this incentive payment will help achieve long-term benefits to the Commonwealth and meet the state's healthcare policy goals. Examples might include leveraging health IT and interoperable EHR systems to improve patient health, coordination of care across service providers, transitions of care, or a reduction in healthcare costs. Anticipated challenges. Applicants should describe anticipated challenges and problems that the organization envisions may occur in meeting the milestones and ways that it will be able to address them. Critical attachments include eligibility criteria substantiation form, attachment A1, the organizational behavioral health profile, attachment A1A. Note the chart should be completed only for those of your facilities that are providing clinical behavioral health services in Massachusetts. The organizational and revenue verification form, attachment A1B, must include the source and page number or location to support the PSR amounts and percentages within the attached supporting documentation, such as the UFR or similar, similar audited report for the most recently available fiscal year. Include a brief explanation of the organization's behavioral health services, which should be broken out in the supporting documentation or explained in a table. The Office's certification form and signature page, attachment A2, and the EHR current product table, attachment B. As I said, we have created an application checklist that is available on the MIHI website. It's a useful tool to reference when completing the application. Again, note that coming changes to attachments A1 and A2 will soon be posted. MIHI will review each application against the following criteria. Compliance. Has the applicant met each of the 6 eligibility criteria, including attestation and substantiation requirements? Need. Has the applicant described why they need the funding and how other sources of funds or resources are insufficient to meet the goals. Feasibility. Has the applicant described a feasible approach for meeting eQIP milestones and achieving a more advanced state of integration and use of health IT? Ability. Has the applicant demonstrated the ability to meet the guidelines and conditions in the solicitation? Capacity. Has the applicant sufficiently indicated organizational capacity to carry out their proposed approach to achieving the milestones? Commitment. Has the applicant demonstrated their commitment to meeting the intent of the grant and all milestones? And impact. Has the applicant addressed how it intends to use its EHR and other health IT to support the Commonwealth's healthcare policy objectives? As I said, we encourage you to email us with any questions. We will also post all Q&As on the MIHI website, mihi.masstech.org, for reference. We also encourage you to visit our education page where we post upcoming events, presentations, toolkits, and other resources. This includes a new EHR planning and procurement toolkit with recommended action steps for providers to begin the planning and procurement process for adoption of EHRs, and includes collateral materials such as checklists, templates, and spreadsheets that you can use and adapt to help collect information and plan for your EHR procurement. We apologize that we had some sound difficulties at the beginning. We only have a few minutes left for questions. Let's see if people have written anything in.
Okay. All right, our first question. How important and necessary for this funding and approvals is the interoperability component, the intended use of the Mass Highway for exchange of info with trading partners at this time? What is considered a trading partner? Is this a fundamental component that must be in place to be approved for funding?
It's a fundamental component of this program. This is what we're trying to get people to. You do not need to be interoperable. In fact, you don't even need to have an EHR to be accepted into the program. However, you must be committed to interoperability and into completing all the milestones, one of which is trading on the highway or an HIE that is connected to the highway. A trading partner is an unaffiliated another healthcare provider that you exchange information with.
We have an existing EHR, however, it is not interoperable and has significant issues. We are adopting a new CERT system. Are we eligible for the grant?
Absolutely. As I stated, it doesn't matter what system you have now, or even if you have a system, you're still eligible to apply for the grant. You are required to have a certified system to meet milestones 2 and 3. However, that gives you some time in the transformation plan of milestone 1 before you have to have that system in place.
Since notifications on amendments to the solicitation will not be sent, will the changes be marked somehow? Otherwise, will we need to visit the website frequently to be aware of changes?
Yes, except for the typographical error where we left out something in one of the attachments. Any changes, the amendment that I talked about regarding the clarification on affiliation will be clearly, not within the solicitation, will be clearly marked on the website as an attachment. But the slides from this webinar and as well as the audio recording are also going to be available there, and that should give you the information you need. If you have any difficulty accessing that or you're unclear what those slides are, please submit a question by an email.
On the initial round of funding, we were able to submit financial statements based on calendar year. Our accounting is done on a calendar year basis and not off of a state fiscal year. Is it possible to submit any financials required in the solicitation based on calendar year instead of state fiscal year?
Yes, we don't require the state fiscal year. If your audited financial statements are done on a calendar year, it's the tie back to the what you attest and the audited portion. That's the critical portion.
Our CPA provides us with a compilation of financial statements annually. Does this suffice as documentation to satisfy the 5th eligibility requirement?
I don't, from that question, I'm not sure what the compilation is. It doesn't have to be a UFR, but it does have to be an audited financial document that clearly shows that the percentages for both milestones, both the eligibility criteria 3 and 5 are met and substantiated by that audited statement. UFR is one good example, but if it's an audited financial that shows that substantiates what you're attesting to, that's sufficient.
We already have an EHR. Do we need to complete the transformation plan?
Yes. What we didn't talk about is if you already have an EHR that's completely interoperable and already transacting on the Mass Highway, you may not be eligible for this. The MRAM questionnaire or survey that you do at the beginning would show that you've already met the milestones and therefore are not eligible. However, if you just have an EHR, yes, you are eligible for the payment for milestone 1 for completing a transformation plan and a use case, and then again for milestone 2 once you document and substantiate that you've met the criteria and the functionality.
Do we, perhaps this is the last question, do you need the UFR to be sent directly from the auditors, or may you print it out and include it with the application?
You can include it with the application. You need to include a eCopy, electronic copy, as well as the hard copy, but it does not have to come straight from the auditors as long as it's documented and signed.
Great.
I think we're out of time.
Yep, we will capture all questions asked during this webinar and include them for posting on May 7th.
And please, any other questions, submit them to the proposals website, proposals
at masstech.org.
Yes, thank you, Olivia. We look forward to having you on board. Thank you.